Yes, absolutely. So hi, everyone. I'm Daniel Goldberg. I am core faculty in the Center for Bioethics and Humanities at the University of Colorado Anschutz Medical Campus. So I'm really pleased to be here and to be able to moderate this panel on work and play in a pandemic. This is part of the Ethics and Occupational Health webinar series. And so you can see our panel today is about pandemic work, the rights of vulnerable workers. And you can read the description down there. Workplaces are mired in financial and ethical dilemmas as the safety of workers and the financial viability of businesses are impacted by the pandemic. This webinar will explore the ethics of essential workers and the impact of coronavirus on vulnerable workers. Panelists, would you like to introduce yourselves, or would you prefer that I introduce everybody for the audience?
Could introduce ourselves, I think.
Okay, please, let's go ahead. Well, let's start with the panelists who's at the top of my screen, and you can see there's general housekeeping there. You're free to read that as well. Let's start with the panelists at the top of my screen. If you'd like to introduce yourself and share a little bit about your background, Sarah Shikes.
Hello. Hi, everybody. It's great to be here. I am the executive director of a Denver-based, small grassroots organization here in Denver called Centro Humanitario. I've been with the organization for almost 10 years, and I'm just excited to share a little bit more about the unique population who we work with and what we're facing, what we've been facing, and some little lights, hopefully, at the end of the tunnel.
Awesome, thank you, Sarah. So next we'll go to Dr. Jennifer Roberts. If you'd like to introduce yourself, please go right ahead.
Thanks, Daniel. Hello, everyone. I am Jennifer Roberts. I'm an assistant professor at the University of Maryland. Actually, I'm in the Department of Kinesiology in the School of Public Health. A lot of my research looks at health inequities, relationship of health with the built environment. But most recently, I've been working with a group, a risk and social policy working group that's been looking at data that we've collected since the pandemic began and looking at some of the impacts in terms of risk mitigation behaviors and just perceptions in terms of the overall COVID-19 risk to not only workers, but everyone. But it's good to be here to discuss all of this with you today.
Thank you, Jennifer. And our third panelist is Dr. Mike Van Dijk.
Good afternoon, everyone. My name is Mike Van Dijk. I'm an associate professor at the Center for Health, Work, and Environment at the Colorado School of Public Health. I am an occupational health and safety practitioner. Been doing that for 20 plus years. And for the last 6 months, other than spending most of my time in my basement doing occupational health and safety, I have also been working with businesses kind of across the spectrum on COVID-related efforts. And in particular of importance for this today is really a lot of work that I did with the meatpacking industry in the early days of the pandemic and really thinking about vulnerable workers. I look forward to talking today.
Excellent. Well, thanks, everyone. It's so great to have you here, and I'm so proud to be a moderator for this. So here's how this will work is the panelists have all generated some questions that they think will be useful and helpful and that speak to their work and their experiences in particular. So I will ask the panelists these questions and we will also try to get some sort of crosstalk between the panelists going as well, right? And so before I ask each question, I'll sort of let the panelists know who I'll start with. So we'll start with a question for Jennifer, if that's okay. And the question I'll start with is, how can we better define who are essential or frontline workers in order to adequately address the diversity of vulnerabilities among all workers?
So thanks, Daniel. I posed this question because in some of the work that I was doing, I started to realize that our definitions for essential and frontline workers were not as precise as we needed to be in order to be protective of these workers. And so in order to really kind of define essential as well as frontline workers, we really need to define and structure the definition of workers based on what I think is a level of vulnerability and actually just basic commuting. So a clear metric of our workers having to leave their home, leave the safety of their home, to go physically report to their jobs and do their jobs. And in even doing that, do they have to commute? You know, are they taking public transit? So therefore, you know, maybe increasing another level of exposure. And then that brings to the other way in terms of defining workers, is the level of vulnerability. So as I said, the commuting and actually physically doing the job, and probably interacting with customers or other clients, that increases their vulnerability. And so I think when we really kind of really shape and look at those nuances of those workers, we can really better define who exactly are essential workers and who are frontline workers, because many of us can be deemed as essential workers, but we don't have the same levels of vulnerabilities as, you know, maybe like a grocery store clerk or someone who has to constantly interact with the public. And so I really do think these clear definitions need to help create like a formal list so we can identify who not only these workers are, what are the industries, and what are the actual tasks that these people are doing in order to really adequately protect them.
Excellent. Either of our other panelists, any thoughts you have or you want to offer on that in particular? Who counts as an essential worker, basically?
Well, first of all, I think the term essential worker is a terrible term. You know, I think it may have applied in the early days of the pandemic, but clearly it doesn't apply very well now. And I think thinking about the workers in terms of vulnerability and risk is really where we need to be headed, instead of thinking about essential or non-essential. And, you know, I think that those are great things to think about, Jennifer. I think the thing that I would add to that is really the risk piece. And it's not just being vulnerable, it's also being at risk at work. And that's really a factor of who are you exposed to, how many people are you exposed to at this point.
Mm-hmm.
So thinking about the underlying vulnerability as well as the riskiness of the work are both important factors.
Yeah, I'll go ahead and chime in as well. You know, this idea of essential workers has come up a lot for organizations like mine that support extremely vulnerable workers and those who are often excluded from government benefits because of, you know, a lot of immigrants and undocumented workers. And so there's been a real push uh, nationally with organizations that we're aligned with for recognizing that, you know, essential workers it doesn't stop that they're not recognized as citizens in this country, but that they are essential to not only, you know, an essential workforce, but to the economy overall. And they're the ones also on the front lines taking care of children in homes, domestic workers. You know, I was just looking up statistics and looked at the Center for American Progress, and while they were advocating for legislation to be passed, the HEROES Act, and organizations were getting together to really talk about how do we protect our essential workers, that the recognition of the undocumented workforce that makes up about a third of the construction industry, the 8,800 DACA recipients who are teachers and in early childhood education, and, you know, the many, many, many uncounted number of workers who are in the homes of people taking care of their children daily so that they can go to work and be on the front lines of medical industries. So I think it's such an interesting term. I think pre-COVID, essential workers was something that we always, you know, had to advocate that all workers, you know, in some sense are essential.
Yeah, and that sort of I think leads to that the next question, I think, which is we'll start with Sarah and then we'll move out to the other panelists. But you know that of course when we're talking about vulnerable workers, there are obviously challenges that arose pre-pandemia, I like to say we're in pandemia now. That seems to be the world, right? So there were challenges that was pre-pandemia. Some may carry over, but there could also be some new ones. So a question is we'll start with Sarah. What do you see for vulnerable, using that term instead of essential, right? Vulnerable workers. What are the new challenges that you are seeing that are arising because of COVID, because of the pandemic? And what's your assessment for what their future needs might be? So new things we're seeing now, as well as future needs for these communities of vulnerable workers in particular.
Yeah, so again, the vulnerable workers that we, Centro Monetario, was designed to support have been what are day laborers and domestic workers. So really some of the most vulnerable in our country, because they don't have access to a lot of things that make them whole people, and things like access to healthcare, access to benefits in their job. So the day laborers and domestic workers are, primarily immigrants, primarily Spanish speakers, from Latin American countries, mostly Mexico. And pre-COVID, they were already piecing together temporary work because of their ineligibility to get full-time jobs with benefits. And so standing on street corners to look for work, word of mouth, and challenges, that come with living with pretty acute poverty levels include and are exacerbated by their rights in this country. So, we already pre-COVID were living in crisis, and organizations like mine, I just want to kind of spoiler alert, that it's not that these conditions didn't exist already. And I think it's going to be exacerbated. Some of the new kind of issues we're seeing, and right away in March, our organization itself and its ability to engage the workers the way we had been has become really difficult, because the access to technology is something that, we were thinking about, but have not thought about as much as we have in the last 6 months. We're not able to see the workers who were accessing our center on a daily basis, or coming to be educated about knowing their rights on a weekly basis, or connecting with each other even once a month, and feeling that community of support. So right now we're not able to provide that. So we quickly had to think, what can we do? And wow, this is only going to get a lot worse. So I have to look at my notes and remind myself, because there's just so much that has been kind of going through our minds as we day by day have been tackling how our organization responds. And so some of the things, there's less work overall. So jobs, we have historically operated a program where employers can hire workers from our center, and that's gone down 70%, and kind of maintained that throughout the summer, which is the highest employment rate that we usually have. So that's been huge. And, we think of it in terms of, at the beginning, we were rapid response. What do we need to do? What are the health concerns? What are the economic concerns? And now we're really focused on the long term, and how to support people to build more capacity for themselves. And technology is going to be a big one. I think the provision of health and mental health services is also going to be hugely important, because of what people are going through, and the rate at which it's affecting vulnerable populations, kind of twofold, threefold, a lot more. So those are just a few ideas.
Great, that was really helpful, Sarah. Thank you. So, Mike, Jennifer, anything you want to add on what you're seeing, or what about how coronavirus and the pandemic is, changing or affecting, the sort of the particular challenges that vulnerable workers are experiencing, or how you think it's likely to change in the future?
Well, I think the one thing that I would add that kind of also just piggybacks what we were talking about previously is not only is that, like Mike said, the risk of the job and the vulnerability in terms of the already existing social determinants of health that already put workers in a very vulnerable position. But I think one thing also that has to really be acknowledged is this constant kind of balancing of risk when you go in every day to work, knowing that when you come home, you may be putting your family at risk. Because a lot of times these workers are supporting, it's a very group kind of oriented kind of family, and you're supporting, the generation above you, the generation below you, and so it's a full household, and so constantly trying to balance that risk of like, not only is it just for me, but what am I going to bring home to my family? But my family needs this income because this is what's sustaining us. And so I think that's a challenge that many of us think about, but I don't think it's not necessary. We can't internalize it the way a lot of these workers are having to deal with this on a daily basis. Then if they do get sick, so it's like, okay, then I'm out of income, and now have I gotten my family sick? So I just think it's just kind of like this ongoing like cascading of just like of a crisis. And so I think those are challenges that should be acknowledged as well.
Mike, is there anything, just turning to you, specific in your work with the meatpacking industry and vulnerable workers in the meatpacking industry that you're seeing that's especially significant, given coronavirus changes, or changes that you expect to see in the future given the pandemic?
Well, I think it's a lot of the similar things that we've heard from Sarah and Jennifer, in that, you know, we keep adding on to this definition of vulnerable, and it's that financial vulnerability, it's that vulnerability of family. So there's different factors that make people vulnerable, and how do we address these as a society and as a worker or an employer? How can we address all of these things at once in order to really help these workers along? And I think some of them, in the meatpacking industry in the early days, they did a decent job of thinking about, the underlying risk of morbidity and whether or not somebody had a very vulnerable family member, and removing those people. I mean, compensating them to stay home. But how long can that last in pandemia, like we say here? How long can that last? Is that really a long-term solution or not? And I think there's a lot of questions that need to be addressed as this extends into, another 6 months. So how long can we maintain those sorts of things? And I think those are really important things to talk about.
Great. So we're going to stay with you, Mike, for the next question. This one is particularly interesting to me. So I'm a scholar of stigma in particular, right? And so I'm really interested in the ways in which we stigmatize and blame people for all sorts of illness conditions and experiences. It's really common in the US. So my question for you, Mike, is, there's a long history of blaming off the job behavior of workers for work-related health outcomes, right? So given this context, how has this played out with coronavirus, and what can we do to move beyond this history and this tendency?
Well, I mean, I think historically speaking, I would definitely agree with you. I mean, it's things like, it wasn't the asbestos that you were exposed to on the job that caused your lung cancer. It was really your smoking that caused the lung cancer. Or it's not the fact that, you don't have opportunities to eat healthy at the workplace. It's you're obese, and that's really why you got diabetes. So really that blaming the worker, there's a long history. And I think that's continued in the pandemic. And in particular, if you start to look at the meatpacking industry and the early reports of it, the early reports of really truly the epidemic that we saw in that industry, it was a lot about focusing on the living conditions of workers, focusing on the density of workers in these environments, and focusing on things like, these workers carpool, they go to church together, all those are important factors. And frankly, yes, some of those could be important factors, but the focus really should be on an employer treating an employee as a person and really thinking about their overall exposure, not just their exposure at work. So I think that in the future, there's this term called total worker health that we need to be thinking about and really trying to address exposures to workers on the job, off the job, wherever they are, and thinking about how we educate workers on ways to protect themselves from adverse health outcomes. So I think there's a new system developing to do that, and I think the pandemic has really underscored the need to address both work and non-work factors. And I think that we really need to think about how we talk about things. And if you look at the data that we've seen since the early days of the pandemic in meatpacking, I mean, there was always this stigma about people living in very high density housing. When they did the research, what they found was the average family size was 2.3, no different than anywhere else. So, we have to remove our preconceived notions and really think about an overall exposure and risk to a person.
So we'll jump now to Jennifer. Any comments on that? Anything you want to offer in terms of thinking about the tendency to blame workers for their behaviors as a way of sort of assigning responsibility in the age of coronavirus?
Yeah, I mean, I think I completely agree with everything that Mike has said, and just furthering along, making sure that we expand. I like the idea of what Mike said, the total worker health. I think I switched some words to the order, but looking at the total person because of the fact that, you want a healthy person, mind, body, and spirit, so they can actually do the job. And so having the appropriate risk communication, appropriate health communication that is, culturally and linguistically appropriate is what is needed, and as opposed to just continuously to blame the worker and say, oh, well, you got this off the job and that's why you're sick, as opposed to having something in a very public health promoting manner to protect these workers. So I completely agree with what Mike has said.
And Sarah, since you're working with a lot of these vulnerable workers on a sort of a day in and day out basis, are you seeing that? I mean, that's one of the things we know, right, is when we're talking about stigma and blaming, the phenomenology of that is, of course, we want to ask the people who are experiencing this, right? Are you seeing that? Are there reports that you all are hearing of people being sort of blamed for any kind of illness experiences that they have during the pandemic and things like that?
I think for us, and something that Mike referred to that's been so important, and again, pre-COVID and exacerbated, um, is the responsibility of employers. One thing that I didn't mention, we talk about vulnerable workers. What are they vulnerable to? It's health risks, but it's also exploitation. And so there's a lot going on, and has been going on. And we continue to hear it's really, the employers themselves are experiencing a lot more hardship. You think about the restaurant industry and they're just trying to survive. So their last priority is the overall wellness and health of their workers, unfortunately. And that's the case in the industries that day laborers and domestic workers are working in. It's affecting a lot more people now than just day laborers and domestic workers. And I think having that come to light is, the overall wholeness of a worker. And we appreciate it. And I think it's going to be, not we for years have been trying to educate our workers, but if it's not the worker and the employer being educated and coming together around what is wellness, and what is a worker who can do a good job because they are housed, they have health care, they had a meal today. Um, that recognition, I think, is really important, and it's going to lie in the hands of the employers. And so, unfortunately, I think right away we're going to see a lot more exploitation happening. We have worked for years and years and years to fight against what we call wage theft. and it's either drastically underpaying workers for work rendered or just not paying them at all because whatever reason, they didn't have the money, they didn't like the quality of the work, but it's really recognizing how that affects communities and how that kind of has a ripple effect. So yeah, not, the blame is there. We definitely get employers kind of calling saying, oh, well, we need this, and this. And our workers, don't have transportation. They might not have a place to sleep that night. So really educating people on what can you do, to support the workers that you're employing.
Great,
Can I
thank you
add
all.
one more thing?
Oh, please, Mike, go right ahead. I'm sorry.
So I think you guys both pointed out things and really and I'm seeing in the questions too, in terms of kind of tangible things that you can do to really support workers. And I think the most important thing in a pandemic, whether it's the flu or COVID, is sick leave policies. Have sick leave policies that allow workers to not be punished for staying home when they're ill. And, by that, if they're allowed to stay home when they're ill, they're allowed to stay home when their kids are ill. It eliminates a lot of that stress, that work-life balance issue as well. So I think that's one of the biggest policy solutions out there is really paid sick leave. And I think, in the early days of the pandemic with meatpacking, the meatpacking industry has a long history of what are called attendance bonuses. So it's not necessarily that you're quote unquote penalized for not being there, but you just don't get that bonus if you're not there. And the financial vulnerability of these workers really kind of push them to make as much money as they can. So it is, in a way, indirectly punishing workers. And then I think the other thing that I heard is really the cultural factors and the education factors and the language issues are really important to think through. I mean, in meatpacking, many of these plants have 20 or 30 different languages spoken. So really making sure that employees understand how to use their sick leave policy is just as important as having a sick leave policy.
Thanks, Mike. And I want to go ahead and just assert moderator's privilege here just to remind the audience that we welcome questions. We will have a Q&A in our session today, but please post your questions, not in the chat, but in the actual Q&A. That becomes much easier for us to resolve and make sure that we get to the questions we want to get to. So please, again, please post your questions in the Q&A, not in the chat box, okay? So this next question, we'll move on, and substantively, this question will be for, we'll start with Jennifer on this question. And, this one is particularly interesting to me because in terms of the legacies of structural and systemic racism in the US in particular, right? People who were watching the pandemic in January and February knew exactly what was going to happen, right? When the coronavirus found its way into BIPOC communities. And for those of you who aren't familiar with that term, BIPOC is an acronym for Black, Indigenous, People of Color, right? So people who are watching, social epidemiologists, lots of other scholars, right, members of these communities, they knew what was going to happen when coronavirus found its way into these communities. And lo and behold, that is exactly what has happened when we look at the devastating sort of racial health inequities that we are seeing with the pandemic mirroring these things in general. So the question, So the question I have for, question just disappeared, sorry. There we go. So the question I have for Jennifer, sorry about that, is are the disparate mortality rates that we see within the Black and other communities of color from coronavirus 19, are they attributable to this essential sort of frontline worker status, right? This vulnerable worker status, or are there other factors at play that you feel are sort of more sort of responsible for these disparate mortality rates?
Yes. So actually, yeah, I to answer this question, I do, everything that we've mentioned in terms of, the risk and the vulnerabilities of actually doing the job, actually going to the place to have to do the job, definitely contributes to the disparities that we're seeing, particularly since, we haven't necessarily defined who are with it, or the demographics of the workers, and overwhelmingly these workers are, have lower education, lower income, or people of color. So you already have this kind of disproportion of the people who are actually essential / frontline workers. But in addition to that, there's definitely there are other factors that are at play, including the poverty, the discrimination, and the consequences of both of that, whether it be, lack of access to a better paying job or a better job with fair pay, quality education, quality housing, even like Sarah was saying, some don't have cars, so the use of public transportation, healthcare. So you can continue to stack up all of these social determinants, which can actually negatively or positively impact any one of us, all the way from, our birth, our growth, our living, as we age, as we work, as we play. All of these can play in such a role that it can either be very positive for our health or negative. But in the case of workers, we're seeing that a lot of these are stacked up against them in a very negative way, which can, heighten that level of vulnerability. And that's why I think we're seeing the disparate rates, particularly among people of color and other marginalized populations.
Thanks, Jennifer. We'll put this question to Mike now. Mike, especially in your work with meatpacking, I mean, I'm not an expert on this, but my understanding is a lot of the workers in the meatpacking industry are BIPOC, right? That they're Black, Indigenous, or people of color, right? So are you seeing this, and to what extent do you think these the disparate mortality rates we're seeing, right, are a function of their vulnerability at work versus some of the larger legacies of structural deprivation and racism, frankly?
I think that's a hard question, but I think that the meatpacking industry is a little bit different in that it's typically, refugees and immigrants are the kind of more typical workers. So the population is slightly different and probably even more vulnerable than the other populations that we're talking about in a lot of ways, in terms of, fearfulness and accessing services and those sorts of things. We've definitely seen a large number of fatalities due to COVID in the meatpacking industry. I think we're approaching 100 in the industry as a whole. So we've definitely seen that desperate mortality in meatpacking, and I think it's a function of all of those things. It's a function of the underlying vulnerability more than anything, not necessarily other things. So I think it's a really tough thing to address.
Sure, understand. And Sarah, do you have any thoughts you want to offer the audience on this one? You're right. I mean, and I understand, and tracking Mike's point, it's obviously difficult to tease these things out, right? The extent to which background structural racism and deprivation is producing the inequalities that we see in the face of the pandemic, when of course they produce so many other inequalities. Teasing out the impact that the actual worker status, right, and the work that's being done, the effect size of that is pretty difficult. But is there anything you're seeing on the ground that you think could speak to this question, any sort of heightened or added vulnerabilities from working during the pandemic?
I think, again, it kind of circles back to our workers being trained on how to use PPE, or is it even a consideration in a lot of jobs? The workers that we see are working in informal markets, and the jobs are informal, and there's rarely training that is involved. So to think about, okay, now there's a whole nother level of health and safety risks. Yeah, I think what we've seen is workers who just straight up are scared to go back to work. Domestic workers, yeah, again, it's hard enough to balance needing to go to work with having young children at home who were at home and schooling and having to leave them to go to work, but then to recognize they don't know what the proper use of PPE is. Where do they get that education? Where do they get that training? And especially when organizations like ours is, where they might get that, it's hard to offer that to everybody who's working. So yeah, it was kind of it happened quickly. And I think getting as prepared as we can as a very small organization, but I think just making sure, again, that the employers are offering trainings because this is their workforce. But I would say that that is a big impact is the training and lack of training.
Right. Excellent. Thanks. Okay, so we'll stay with Sarah for starting our next sort of question. What new groups of immigrant and low-wage workers are you seeing that are being affected by the coronavirus, and why, or how are they being impacted?
Yeah, I mean, so it's so interesting. You know, for years we've been trying to focus really on this group of domestic workers and day laborers. And I went out to the street corner where day laborers gather about 2 months ago now in August. Just, you know, we took our masks and we went out because we wanted to talk and hear from them about what they were experiencing. And I met an individual who said, oh, I've just been, you know, coming to the street corner for 3 months. And I said, well, are you new to Denver? You know, why? And he said, well, I had a job with a restaurant for 8 years. I worked at a restaurant and that restaurant had to close. And so now I have no work and this is where I'm coming. So I think, you know, the restaurant industry being affected is also having an effect on, and I think we're going to see such an increase in people who are looking for temporary work, who have not been typically in the construction landscape industries, who have not been taking care of children and elderly in the homes, now doing that. So the other piece that is really interesting and probably a little controversial is that a lot of undocumented workers may have had consistent work using a relative's, you know, ID or in some way. And so if they have lost their job, not only can they not get unemployment, but now there's probably much less of a likelihood that they're going to find that consistent work again. So we're going to be looking at a gig economy and an informal work sector that is just growing and growing. And I think restaurant workers, I think, you know, childcare workers, people being out of work are going to be needing to do something.
Mike or Jennifer, do you have any comments? Anything you want to offer on new groups of immigrants or low-wage workers we're seeing that may be especially vulnerable during the pandemic?
Yeah, actually, I wanted to add. I saw an article. I think it was a couple weeks ago, and I believe it was Washington Post. But they were talking about the millennial and actually even younger generation of workers who are having these like kind of multiple like low wage part-time jobs, in the sense that, you know, and a lot of them are college students, saying that, you know, they're at a different level of vulnerability because, you know, they're going from multiple jobs to multiple jobs, and saying how, you know, let's stop blaming this generation because they're not all partying, you know, spreading COVID like, you know, some of the narrative is trying to perpetuate. But a lot of them are just vulnerable because of the fact they're having to go to these multiple, you know, part-time jobs because they have not either finished their training or their education to get to, you know, something that's maybe a little bit more stable. And so I think looking at that population of workers is another way to look at, you know, this kind of new group, you know, and then also too, this group may in somewhat be stagnated because of COVID. So being able to finish school or being able to move to the next stage of life, you know, and so I think that's a very interesting group to look at because there's been so many, they've been hit in so many ways. So, you know, I just wanted to add that one as well.
You know, I'll just add that it's interesting to have this conversation because I think we were all talking about all of these groups before the pandemic, and nobody was listening at that point, and nobody saw the same problems that we saw. So, and I think all of these vulnerable workers have had these issues for a long time, and I think the silver lining of this pandemic is that we're starting to identify, we're really highlighting these concerns and addressing a lot of these issues out front now, instead of, you know, talking behind closed doors in academia with nobody listening. So I appreciate the opportunity to talk about these things.
absolutely. It's good. It's sort of sad that it has to be revealed by a out of control pandemic, for us to be able to be sort of paying attention to these things that, of course, we should have been paying attention to for generations at least, right? But so, Michael, I want to sort of stay with you now for this next question, which is, also something that's particularly interesting to me is let's think about, the sort of the connection with the regulatory state, right? Because we've been talking mostly just about private employers so far, but of course, occupational health is and has historically always been a function of what regulators and the administrative state is doing in conjunction, right, with private employers, right? So the question is, from your perspective, especially as an occupational health and safety professional, do you think the regulatory agencies, state, federal, local, if you want, have adequately responded to protect vulnerable workers in industries like meatpacking?
My answer would be a resounding no. They have not responded efficiently in order to do this. But I'll say, this is a difficult situation. This is a situation where you have this intersection of public health and occupational health. And that's this place where, where does public health stop and occupational health start? And traditionally, it's really been state health departments that have thought about public health issues and really things like masks and pandemic protection. But here we are now where we have to think about this in an occupational environment. Now, some states, I could think off the top of my head, like Minnesota and California, have been thinking about this for a long time in terms of making things called pandemic preparedness plans and requiring employers to do that. There was a failed national effort to introduce that sort of regulation several years ago. So as many things, a lot of our problems can be traced back to inaction years ago. But I think that OSHA and others really failed to invoke their emergency powers in order to start to regulate this area early enough. Others really weren't putting out guidance fast enough to really try and protect workers. And in particular, I mean, I keep coming back to meatpacking as a great example because this was one of the first places we really saw this epidemic hit. And, the meatpacking plants were really a month into this before they had any sort of concrete guidance on how to address this issue. It was really like drinking from a fire hose. Every day was a new plan of what they should be doing. So the employers didn't have the information they needed to be able to protect employees. And the regulators weren't acting fast enough to really establish those regulations. So I think it's been a clear failure of regulations in this pandemic in terms of places like OSHA that really haven't, and have continued to fail as well. They didn't put out regulations, and now they're really not doing that much enforcement either. So I think it's been a long, a long fail of that agency that needs to be addressed in the future.
Sarah, Jennifer, anything you want to add about what agencies, what the regulatory bodies have or have not been doing, or recommendations for what they need to be doing moving forward?
I mean, yeah, as Mike says, this is not new to us, that we have been part of coalitions and partner with organizations that for years have been looking at regulations overall and the wellness of workers. Most recently, the Colorado Department of Labor and Employment, there was a big effort to change the minimum wage order after 20 years of excluding construction workers, excluding some of the most vulnerable workers from simple things like overtime pay and breaks during the day. And so when you think of that, that's where we were before the pandemic, that we had to fight for all workers to be covered by overtime and get breaks. That it's just, it is like drinking from a fire hose. What can we do? What is the legislation? Not to mention, we're looking at an upcoming election that's going to have a lot of effects on a lot of people who haven't been in the vulnerable worker category that are going to now be in that category.
I think the only thing I wanted to add is I agree with Mike that, you know, the efforts from OSHA and the regulatory agencies have been lacking. But the one thing I would disagree with is I've always felt occupational health was a part of public health. It was kind of like, you know, even when one of my first classes in my school of public health, you know, our case study was like the triangle shirtwaist fire. And we talked about that as a public health concept. And so I always have felt like this is something that should be approached. Yes, you know, it's regulated by OSHA, studied by NIOSH, et cetera. But it's such a public health piece of public health that I've always felt like it's not something that should be looked at as separate. So that would be the only thing I would add.
And then Jennifer, I would completely agree that it should not be thought of as separate. And public health and occupational health are the same thing.
Mm-hmm.
My argument was really around the way it gets implemented. There leaves a giant gap between public health and occupational health that most states don't do a good job of filling.
Yeah, I would agree with that.
Right. It's interesting. We create scholars of sort of regulatory policy refer to these sort of regulatory or policy vacuums, right? Where it's like the Spider-Man gif, right? Where everyone's kind of pointing at each other. Well, I thought it was your job, and I thought it was your job, right? And it creates this space in which, you know, there's a drastic need for regulation in the name of public and population health. That just doesn't happen, right? Because sort of this vacuum has been created by all these parties who don't see it as their sort of responsibility from a regulatory perspective. And we have very good evidence that these vacuums appear in all sorts of ways in different public health contexts, and that they have devastating impacts, to be honest with you, right? Including occupational health and also going beyond it.
Well,
So,
I think it's also it's a bit of a paradigm shift in that typically when we think about occupational health and safety in terms of infectious disease, we're thinking about protecting workers from infectious disease brought in by patients, brought in by animals, brought in by products. We don't typically think about protecting employees from each other. And that's just not the normal paradigm. So I think it's been a paradigm shift somewhat that we need to think that way. It really shouldn't be, but that I think people think in different ways. So it is somewhat of a paradigm shift.
Fascinating. Again, that idea of external and internal, right, being really sort of interesting if you think about the sort of the spaces of these environments and things like that, right? Okay, so just the way this session works, I should have said this at the beginning, I apologize, but we will have some time for Q&A from the audience, and I know we've got some questions sort of banking there. So we'll turn to that at about the top of the hour. So we still have a time for a few more sort of panelist generated questions. So I'm going to push this one over to Jennifer to start with, and asking, why is the COVID-19 pandemic more of a vital threat to women of color workers in particular, right? We know that risks are not distributed equally in our society. That's obvious, right? And so I'm really thinking about the risks as that women of color workers actually experience in the pandemic. So what's making this more of a sort of vital threat for them?
Well, one key thing is that women of color really stand at this intersection of several different levels of barriers, you know, and so it's barriers maybe with the gender, barriers with race, ethnicity, or other forms of bias. And so women of color already have to deal with that, or workers of color already have to deal with those various barriers. But I think also when we think about it, you know, there's really some kind of like deep rooted in kind of cultural attitudes and stereotypes that have devalued some of the jobs that women of color have had, you know, jobs such as service jobs, jobs of caretaking, almost like, well, you're a woman of color, you're supposed to do this. So, oh, I have to pay you, like almost as if it's just devaluing the work because of who the person is, a woman of color doing the work. And so this has just been shown historically, you know, in terms of discrepancies in wages. We've all seen the statistics. So like for, you know, for every dollar earned by a white male, you know, it's pennies on the dollar, like maybe 60 cents on the dollar or something for like Hispanic women or African-American women. I can't remember the exact cents, but it's definitely a disparity. And then also, I think the reason why this has kind of been more of a threat, this pandemic has been more of a threat for women of color workers, is because they're often having to juggle a lot of the household responsibilities as well as, you know, when they're having to do their work responsibilities. And a lot of these workers are disproportionately in certain essential industries, such as healthcare and service industry, as I mentioned before, and that also puts them at an additional risk. So I just think it's like a series of different barriers and other risks that put them at an addition, that it kind of exacerbates the already existing issues that they're facing.
Mike or Sarah, anything you want to add in terms of the particular sort of risks or the elevated risks or the pileup of risks, which I've often heard social determinants of people sort of use that, the idea of accumulated and sort of pileup of risks that women of color in particular may experience whether in the workplace or out with regard to the pandemic?
I think, again, you know, we're connected very closely to the National Domestic Workers Alliance. And so, yeah, it's not just immigrant workers, but that alliance is made up primarily of women of color. And so just, you know, hearing and recognizing the challenges that women have versus men, you know, is different because they are the caretakers of their family generally, and sometimes, um, you know, are the only also income providers. So I think that again, that balance of their responsibilities at home versus having an income is really a challenge. And so, you know, you think about the overall stress on that of doing all of that and then how much more they're needing to do during COVID. It's an emotional stress. And, you know, when I'm stressed, I get sick. So just being a lot more susceptible also, and being again on the front lines.
Yeah, and I think that it really speaks again, and I keep bringing up the word total worker health, but this pileup of risk factors really speaks to the need for total worker health and to start to think about, how can employers help with things like emergency childcare? How can employers help with things like mental health, with stress management, all those sorts of things? Those are all pieces that are important parts of the whole person. And we need to be thinking more holistically about these issues rather than really compartmentalizing people's lives.
Absolutely. So we have time for, I think, one more panelist sort of generated question, and then we'll break out into the Q&As. And I'll help the panelists with that by putting the questions to them as well. But the sort of forward-facing question, we'll start with Sarah for this one. But what can the general public do? How can the general public support vulnerable workers to, quote unquote, survive? Survive can mean lots of different things, right? But to survive this crisis from a health and economic perspective, what can the public do?
I keep muting myself. Yeah, thank you for this. I think it's important, and I said I was going to talk about silver linings, and I know it's hard to keep a smile on our face when we're talking about a lot of doom and gloom for a lot of people. But I think Mike alluded to it, and thinking about, a lot of people are workers, but they're also employers. And thinking about those who you have employed, the people who maybe come and clean your house or have typically been engaged in working for you in some way, to make sure that you're looking out for them. That if you have a nanny, that if you have a house cleaner, that even if you're asking them not to come during this time, give them something, pay them something, recognize that the value of their work. I think, asking companies that you hire to do home improvements. There's a lot of people, doing things to their houses these days because there's not a lot of other things that they can do right now. So ask those companies, how do you treat your workers? How do you pay them? Are you offering benefits to them? Really challenging employers to think about the total worker, just as Mike says. I always have to say it's not just my organization, but donate to organizations that are on the ground. I think for years it's the vulnerable workers, but it's also the organizations that support them that are struggling and scraping by to be able to support. We've been really lucky that, we have about 18 years here in Denver, and we have some amazing allies and people who have supported our organization, and they have come forward to say, it's not just I want to support your organization, but this donation is to help support directly workers. So we have been able to link a lot of workers, about 1,500 workers, to funds, direct funds. Now, never enough. It's not, anything close to what they were making, but it is helping them to at least survive, get through a time until they can go back to work. And vote. I don't think I need to say much more about that, but the policies, even sometimes they don't affect the workers that we directly support because of the marginalized nature of who they are and politics and policies in this country. But really any policies, like as Mike said, that really looks at the total worker is important. And so look into those, investigate and vote for not only the candidates, but the policies as well. And then just be aware of the legislation that provides basic protections for all workers. That's my list.
So I'll add on to that, and I'll underscore the word vote, please. Everybody vote. And I think that in general, I think kindness is important. I mean, really recognizing the contribution that everybody has and making sure that you acknowledge that is important. And then, I think we need to think longer term about this. We need to think about a livable wage. We need to think about increasing the minimum wage. We need to think about more protections for workers long term, because, where we are right now, workers are at a clear disadvantage in all of these situations. So, unions, organizing, voting, kindness, all of those things are important to get beyond where we are now.
Jennifer, anything you want to add before we jump into the Q&A?
No,
okay.
That was good.
Okay, well, to that point, Mike just mentioned unions. And we know when we think about the history of occupational health in particular, that organized labor, especially in the US, but in many other places, have had an enormously significant role, right, in changes in workplace health and in occupational health in general. So this is, for Mike mentioned it, but this is a question for any of the panelists. What do you think the role of unions should be in establishing occupational safety and other worker protections during this pandemic?
So I can start since I mentioned it first. I mean, really, as you said, unions have a long history of protecting workers. And I think unions have a responsibility during this time to advocate for better policies in terms of sick leave, in terms of attendance policies, in terms of working conditions, and in terms of negotiating things like personal protective equipment. So I think we've seen in industries like construction, where you have a unionized workforce, they have better protections than a non-unionized workforce. I think we've seen places like service workers, where you are in unionized environment, they have better protections and better outcomes than non-unionized environments. However, we also have to acknowledge that all unions are not created equal. and the relationships aren't the same for everyone. So there are times where, you know, a situation like this can actually make the relationship between management and unions a lot tougher. And I think that if we look back to meatpacking, that's a predominantly unionized industry, and there's a whole lot of factors out there, political factors included, that really contributed to the issues in meatpacking. And I think that those union negotiations are tough in an environment like that. So it's not, unions won't always help, but they tend to lead you down the right path. So I think there's a clear role for unions in this issue. Anybody else want to weigh in?
I mean, yes, I just have, we're definitely pro-union, and we really have been able to see the strength in unity, and when we collaborate and when unions are involved in really having the workers speak out for changes that need to be made. That's really important. And it is really about that there is a stronger voice when it's more people who are telling the story. So unions have a big role in that. I also recognize that, there's a long history with a lot of unions, and it can get political, but for us, I think they can have a lot of strength, and I think they need to build more power.
I think I would agree too with what has been said, but I also think one good thing is how the demographics of unions have changed. I mean, historically they've been predominantly white men, and we're seeing how they're becoming more and more of a diverse group, representation of people of color and representation of women. And so I think, as Sarah said, more people coming to the table. That's a good thing, so that you can have a better chance of being able to more adequately and effectively protect all of the workers, whether that's wages, getting personal protection. So I'm a favor for unions as well.
Awesome, thanks. So let's talk a little bit more about some of the costs of these kinds of proposals, right? So one of the sort of one of our sort of audience members has indicated that adding things like paid sick leave, distancing between workers, transportation necessities, worker educations cost money. These things can dramatically increase the costs of production. At this time, we all should have seen the cost increases in groceries. Ultimately, these costs will be passed on to the consumers, like the current trend to add COVID cleaning fees by restaurants and hospitality. Are we all willing to bear these additional costs?
I mean, I think historically that's been an issue, and that's been a lot of people's arguments about, tougher health and safety regulations. However, the biggest cost in a business is human capital, is labor. And these are all efforts at really protecting labor. And I think that, employers' motivations in terms of what they spend their money on are always the biggest determinant of what happens. So I think that really watching how this has unfolded, watching places like meatpacking, where you've seen a facility with 3,000 workers come down with over 900 cases of COVID and 4 deaths. I mean, that's a big deal. If you look at what's happened over the weekend in terms of a large gathering where you've seen COVID spread to a large number of people, there is a huge risk in spreading COVID to workers and to customers. So I think this is a necessary investment, and it is unfortunate, but I'm pretty sure that much of that's going to be passed on to the customer. But I don't really see any way around that.
It's interesting that this question came up. I think it's a interesting question. I don't necessarily have an answer for it, but I know there was a similar proposition where I can't remember which state it was, but they were putting like an automatic 35% fee on top of restaurants or a cost of meals to cover tips, etc., for the workers. And so it's almost as if, I think about, the shift in the cost, or the cost between the employer, the cost between the consumer, and who bears the responsibility of most of that cost in terms of, yes, you might be getting a commodity, but what if you didn't like the service, for that waiter or waitress? Or what if you wanted to say, oh, maybe it's a 10% service, but not like a 35%. So it kind of takes some of that ability to have control in, saying whether or not you were pleased with a certain service. But at the same time, I do think that many of these costs in terms of having protection for workers have to be, spread out among consumers and clients. And so I'm not really sure how to do that. But I do like to pose the question of, not necessarily having these blanketed additional costs.
And to me, it's just the recognition that, workers are also consumers. And so if you're supporting your workers, they can be consumers.
Mm-hmm.
So really, it's kind of the cycle of, yeah, things might cost more, but maybe more people will have access to them as well. I think we're so from a mindset, and our society functions from capitalism and making a profit. And so if we could even the playing field a little bit, I think our economy actually would benefit.
Yeah, and I'll just assert moderator's privilege to say, as a public health ethicist, one of the issues, of course, is that we've gotten used to enjoying the prices which don't have the things that workers need built into them, right? So there's a sense in which if we can only have low prices by exploiting vulnerable workers, that's an ethical problem, right? And maybe, and yes, of course, raising prices is a problem, but the fact that they've been so artificially suppressed by basically exploiting vulnerable workers is not something that we should sort of ethically endorse as continuing, right? Maybe the answer is, as you all are sort of suggesting, ethically, we have a responsibility, right, to pay for the things that people need, right? At least to some extent. And that's not going to win the argument, but I think that should be considered when we sort of think about what's the status quo and what isn't going forward, right?
Thank you for that, Daniel.
Well said.
Yeah, well, I couldn't resist. I apologize. Okay, so back to you, who are more important. Okay, you are the panelists, you are the experts here. So another aspect of vulnerability important to recognize are workers exposed to COVID-19 with no ability to file for workers' comp benefits. Some states have broken workers' comp law, and workers are afraid to file due to fear of retaliation. So just opening that up for the panel, to what extent is that a problem? To what extent do you think it needs to be addressed? What should we do about it? Those kinds of things.
So from my perspective, it's hard for me to speak about all the different states out there, and workers' comp is a state-based program in most states. What I can say is that I think workers' comp is still in the process of really sorting out whether or not this is a compensable condition or not. And I think there's going to be a huge amount of litigation, and we're getting phone calls from lawyers almost daily asking for our help in these sorts of litigation around whether or not contracting COVID at work is a work-related condition. It's one of those issues. It goes back to blaming the worker, but it is a difficult situation because when you have community spread of a disease, proving that you contracted that at work versus you contracted it at home is difficult. So I think there's going to be a lot of litigation that sorts this out in the future. I don't think we have all the answers yet. I wish we did, but I think you'll start to see where this shakes out in the next 6 months, which is not fast enough for most of the workers, I acknowledge.
I think, not that having that fear, to me, it just continues to exacerbate the problem, because if you have workers who are not wanting to, go and file for workers' comp, then, you may have issues where you have inadequate contact tracing for other workers. And so you may have, other, outbreaks within the workplace that you may be aware of, or you become aware of after after the fact. Or you may be in a situation where, the customers are even more, at risk. Yeah, I had a family member who actually, she lived in a assisted living facility, and she ultimately contracted COVID and died, but they didn't tell them. There was like 5 workers who were ill, and so it was just like this ongoing, it was like a delayed response because people were not wanting to reveal, like, oh, did I bring this to work, or did I get it from work? And I just wish that, even people who just didn't really understand what their rights were, if they were able to go to a legal aid, and see, is there a labor attorney I could speak to, just for people can kind of understand their rights, and then make more of a, informed decision of what they want to do, whether they want to reveal their status or not. But, I hate when people have to operate in a sense of fear and not do anything.
I want to add something I just saw in the Q&A. In New York State, COVID has been recognized as an occupational health illness. So I'm guessing there's other states where it's at as well. It's a little unclear about how you prove it's occupational versus community acquired. So I think that's some of the stuff that's going to be sorted out.
So this next question, and Sarah, I didn't mean to jump over you if you had something you wanted to say, but this next question actually tracks, the reason I wanted to sort of jump in and pose this one is because it actually tracks perfectly well with Jennifer's answer to one of the last questions, which is about worker rights and then what employers are responsible for. So the question is, regardless of an employee status, whether they're a full-time employee or temporary worker, are employers mandated to inform employees when other employees are infected with coronavirus 19, right? And then there's a follow-up question, which is, what are the ethical responsibilities to healthy or vulnerable employees when employers do not inform of the public health risk to others? So 2 questions, right? The one is, first of all, do employers have to inform other employees if one of the employees has been infected? Right. And then maybe if they don't, or they choose not to, right, do employees have an obligation to inform, right, in order to lower the public health risk to others?
Anybody want to take this?
I can pose those again too in order. So let's start with the first one. Let me. That's too much to consider. Let me stop there, Mike. I'll let you answer. But the first one is: are employers mandated to inform employees of other employees being affected with coronavirus?
In most cases, they are not mandated of informing about the direct employee that had coronavirus. They are mandated to do contact tracing and investigate that case. But how they do that and whether or not they inform people that who got coronavirus, they don't usually do, and actually they shouldn't do with regard to HIPAA. But they are responsible for investigating that and doing the contact tracing around that and reporting that to the health department, who does further contact tracing.
I think I will jump in. I don't know if it's going to answer the question, but just thinking about fear and retaliation and reporting and honest information, and how employers respond to the mandates. I think what we've seen pre-COVID and continue to see is that the enforcement of policies, things fall apart. So there may be laws there. Someone might know of a law, although there's been so much confusion about what is and what is not during this time, especially. But the enforcement of that is really where a lot of times we fall short. And I think the fear of retaliation is incredibly real for a lot of people. And I'm not just talking about immigrants, but definitely people of color and people who are working in low wage jobs overall, that, the worst thing that can happen is they lose their job. And so hiding the fact that they have COVID is probably a real thing. And I think for employers, hiding the fact that they know someone had COVID, they don't want to close down. They don't want to go through what they need to do because their business will be affected. So yeah, I just don't see that enforcement is a thing.
So I think the question was, though, ethically, should they do that? Which is a totally different question. And I think that ethically, the employer is responsible for doing the contact tracing, for quarantining close contacts, for doing all of those things, and as well as reporting it to the health department. I think that, none of us have ever seen the public health police because the public health police don't exist. And I think that really is a really good point. Maybe they should exist because there's not much enforcement on these things unless you get to really egregious cases. So enforcement is an issue both for labor law and for public health law, as well as for occupational health law. There's not a lot of enforcement of any of those things. So the ethics do matter.
I would agree. It's funny that this question came up, and I don't mean to keep inserting personal examples, but my mother is she's 69 years old. She hasn't retired. She's still a fourth grade teacher, and she's teaching at home. But in New York State is where she's at. They are required to go. She is required to go physically in the building 2 days a week and do the online in the classroom. I don't understand that, but in any case, so there's 2 times where there's some teachers going around the classroom. And I was leaving to come back to Maryland, and she said, I just got a call from the Buffalo Teachers Federation. Someone has COVID. Why won't they tell me the name? And I said, well, Mom, that's HIPAA. They can't tell you the name. And I was like, well, I'm not even sure if they were actually legally obligated to even tell you that. And so it's funny that this question was going on. We went on this whole thing and we're like, well, ethically, of course I should know. And she's like, I'm 69. So I think obviously ethically, I do believe that, it's an ethical obligation for employers to at least let people know, that another employee, maybe another employee that, was in a building that you were around. So that person can make appropriate, measures in terms of getting testing and even just figuring out the timing of whether or not they cross paths with that person. And I think the second part of that question was whether or not employees are ethically obligated. Was that, it's funny, that second part, I actually I really start, like, I'm so wholeheartedly like on, definitely ethically, obligation for employers, but I'm kind of on the fence when it comes to employees because I'm not sure in terms of, kind of like what Sarah was saying, like they may be afraid that they may get some, flashback or so. I'm kind of on the fence with that, in the sense that whether or not you should feel ethically responsible as an employee to let someone else, to let people know that another employee, has contracted COVID. So I'd have to ponder that some more.
Ethics questions are always hard. That's why we have the ethics people on this call.
Yes.
But I would say that, from my perspective, yes, it's an ethical requirement for you as an employee. Especially if, there were other people that were exposed during the time that you could have been infectious. I would venture to, I am not a human resources lawyer, so don't take this as legal advice, but I would venture to guess that given that you have a policy that you don't come to work with COVID, if an employee knowingly comes to work with COVID, my guess is that would be cause for termination. So there's also that reason to report. But I think ethically it's important. You're trying to protect your coworkers as well. And it's an ethical and legal obligation for the employer to maintain the confidentiality of your report as well.
Sarah, anything you'd like to add to the second question in particular? It's really interesting, right? Sometimes I talk about this with ethics, right? Like oftentimes there are all these structural constraints, right? So my supervisor, Dr. Winia, will sometimes say there are often two types of applied ethical problems that people will experience, right, in day-to-day life. The first is where they don't know what to do. And the second thing is where they think they know exactly what to do, but they're having a really tough time doing it, right? This one strikes me as more of the second one, right? There are structural constraints, right, that are making it really difficult for someone to report that they have this illness, for the protection of their coworkers and for others. And those constraints are real, by the way, right? I'm not minimizing them. To Jennifer, your point, I mean, they're very serious, right? And so part of what makes ethics in daily life difficult is that it's not a perfect world, right? There are structural constraints which are the results of things like racism and deprivation and other kinds of structural violences and things like that. So is this something that, Sarah, you've seen or you've experienced with some of the workers, right, wanting to sort of report something in this case but having a difficulty of doing so, or do you have an opinion on it at least?
I think I don't have any specific stories about, that ethical dilemma amongst workers. They haven't really talked about it. And honestly, testing and knowing that they had COVID, might not have been something. But just the ethical issue, of going to work sick in general goes back to, yeah, we want to be ethical, but we have to decide, between losing our job or even losing a day's wage, which can be just as important, and supporting your family. So it's hard. And I have to say too, for an organization that works with communities that are having to look at that kind of ethics, it's hard to advise them, and recognizing that their challenges are not the challenges of most. That yeah, it's more than just the ethical decision to say, I'm sick, I'm going to stay home, doesn't matter if I don't get paid.
Absolutely. Okay, so panelists and audience, I think we have time for probably one more question. So the question that I think that I'll ask is one, and this is interesting because we've been talking about vulnerability, and I've heard recently, I'm not sure if any of the panelists have heard this, I've heard recently, because vulnerable groups and communities is a well-known term in public health, right? It's been used in epidemiologic research for years now. But I've heard recently some pushback on the term vulnerability, right? Some pushback on the idea that groups and communities should be regarded as vulnerable, in part because of the idea that it might sort of strip the idea of agency away, right? It's not just that some groups are vulnerable, it's that we have endorsed social conditions and organizations which have created differences in vulnerability between groups, right? And so that's what really matters. So the question here is, how do you all see the difference between a vulnerable workplace and a vulnerable worker?
I think that's an interesting concept. I think we've talked about vulnerability in workers in terms of risk of infection, risk of morbidity, financial vulnerability. We've talked about family vulnerability. So I think we've talked a lot about the worker vulnerability piece, but I think that the workplace vulnerability, I'm reading some into the question, but we're talking about workplaces that are vulnerable to not being around anymore because of the pandemic, places like restaurants, small businesses. And I definitely think that that's an important thing to start thinking of, or to continue to think about. I think small businesses do need some support to make it through this pandemic. And I think that we haven't been talking about that enough, and we haven't done enough to address the needs of small business. And we've talked a lot about all the things that the employers should do, and we haven't really acknowledged that it's really complicated to be a small business employer. I come from a family, both of my parents were small business owners. I know exactly what that looks like. I know how much time and effort it takes to be a small business owner. And I think that we don't do a good job of making things accessible to small businesses in terms of what they should be doing. And I don't think at this time we're really doing a very good job of making resources available to small businesses. So I think that's an important concept that we really haven't thought about, that term. And I think that term can be really taken further and really, meant to mean something as we go forward.
I think one of the things, when I think of vulnerable worker, I almost think about all of the factors and the variables for that individual person that either helps them or doesn't help them before they even get to the job. So vulnerabilities of maybe their pre-existing health status, vulnerabilities of do they have childcare, can they afford childcare, vulnerabilities of how to get to the job. I mean, all of the things that make someone maybe even more or less vulnerable before they even get to the job. And then even being on the job, are they able to be engaged in work, or are they, thinking about, oh, I have to leave exactly at this time because I have to go pick up my 3 children. Or I just think of all of the things that make that individual, because you could have someone who's working in a workplace that is not vulnerable, but that worker is vulnerable because of all of the variables that make it very difficult for that person to get to the job, to do the job. And so that's how I kind of differentiate it. And a lot of the things that, like Mike was saying, like, yes, there are, businesses, like small businesses that are like vulnerable businesses, but you may not necessarily have someone. You could have a person who's not a vulnerable worker at a vulnerable job. You could have a woman or a man who's like, I'm just doing this because I'm retired and I'm bored. So I want to go, take this extra job, and great, I'll have a paycheck, but I'm just doing this because I'm bored. That person may not necessarily be a vulnerable worker. So I differentiate the two in the terms of what you're bringing to the table or what you can't bring to the table.
And I think my perspective, it's interesting because, as a small nonprofit, we are also an employer. And I would consider that we, one of our priorities is to hire people who are those who we are supporting. So it's a balance of being a vulnerable workplace often, because that we choose to also engage and hire vulnerable workers. So a lot of times those who are doing the work are also struggling themselves.
Well, thank you all so much. We are at 1:30, and one thing I try to do is end things on time if we can, because I would like to thank the Center for Health, Work, and Environment, of course. And I would like to thank our panelists, Jennifer Roberts, Sarah Shikes, and Mike Van Dijk. Thank you so much for your time and your expertise that you shared with us here today. Just a couple notes. Please remember to complete the webinar evaluation upon your exit. You can also complete your own certificate of attendance there. The recording will be available on the YouTube channel for the Center for Health, Work, and Environment later today, and there's a link in the chat if you would like to look at it. Kira, is there anything I'm missing that you'd like to add before we let everybody go?
No, it sounds great. Thank you so much for a great webinar.
Thank you all, and please tune in for our next version in the series, in this series. Thank you so much.
Yep,
Thanks,
November
Daniel.
12th. We'll be back for the last in the series. Thank you.
Thank you.
Yeah, thank you, Daniel. You're a great moderator.
Thank you all. I appreciate it. Thank
Nice
you.
job.
All right.
Bye, everyone.
Bye.
Bye.